Hi, I'm Dr. Windisch. I'm from Sparks Pediatric and Adolescent Medicine. This is actually part of a much larger video series for parents. Today I just want to welcome you to our office. And we're going to take you on a little tour and tell you a little bit about how we do things. But first I wanted you to get a chance to meet me and in a second the rest of our staff. Let me tell you a little bit about how we do things here. We are a reasonably high-tech office. Everything here is done on an electronic medical record, so your records will never be lost or misplaced. We'll be able to find you as we need you. We have all of the vaccines that you need for school entry here in the office. However, it is important you realize certain insurance companies do not pay us what it cost us to buy the vaccines. If your insurance company is one of those that is paying less than our cost on vaccines, we will be happy to provide you the vaccine outside of insurance channels, and you can pay us directly for the vaccine. Or you can go to the health department, or you can go to any of a number of vaccine clinics in town. But we will be unable to provide you the vaccine and run it through your insurance company if they pay less than our cost. If your insurance company is paying more than our cost, or at least at our cost, we'll be happy to provide you the vaccines here and run everything through your insurance for your convenience. We are open 5 days a week, and we have same-day appointments. If you call us before 3 o'clock, in 7 years, we've never turned anybody away. If you call us after 3 o'clock, many times we can still get you in. That one is a little bit trickier. But we don't want you having to go to the emergency room. We'll be happy to see you here. We provide a full range of pediatric and adolescent services from birth to at least 21 years of age, sometimes older than that, including but not limited to all adolescent services like birth control, STD testing, pregnancy testing. We hope we don't have to go down that road, but we can certainly arrange that for you. We also provide stitches here in the office, and we're trained at doing certain plastic surgical closures so that you get the best possible closure of your child's facial laceration. We can do splints if we need them here in the office, and we'll take care of your fractures much faster than the emergency room will, and with much less expense for you. And we're able to provide IV medication and IV fluid if your child has persistent vomiting to keep you out of the hospital, and that eliminates the #1 cause of admission for children year-round, which is diarrhea and dehydration. It's just not an issue for us. We're able to take care of that here in the office for you and save you a lot of money. We participate in pediatric urgent care after hours, so if your child is sick on weekends or holidays, there is a place to go, but we'll remind you if you're in the emergency room or any urgent care, it is important you follow up with us the next business day, because even the best urgent care is not the same as seeing your regular doctor, and follow-up is critical. If you want your child to be safe, you want your child to be healthy, you need to follow up with us regardless of what they say in the emergency room or ER, so that we can make sure you stay healthy and safe. To that end, that is our office policy. We do provide full range of well checks, and we require well checks for our patients, and we follow the American Academy of Pediatrics well check policy guidelines, and those are posted on our website as well as available here in the office or on the American Academy of Pediatrics website, www.aap.org. We have all of the vaccines that you need here for school. As we've already said, we do require full vaccination for our patients because we don't want someone bringing in measles and spreading it to our preemies and killing them off. So you can be reasonably assured that the other children in the waiting room here will not be spreading contagious, or at least vaccine-preventable contagious diseases to your child while you're in the waiting room waiting. And we're happy to get you in and talk to you. So what we're going to do is pause this for a second, and then we'll introduce you to the rest of the staff. This is Pat. She's our nurse practitioner. She doesn't like to talk on camera, so I'm not going to make her say anything. But she is also a clinician here in the office. You may see for both sick and well visits, and she'll be able to get you in the same day as well. Okay, so as we start our tour of the office, we're going to start with just a look at the parking lot here. As you see, we do have ample parking here in the parking lot. There's also some parking across the street and on the street if you need it. Handicap parking is available. I'm standing in the handicap parking spot, and there is a ramp over to my right. This is our front door here. Now we'll go ahead and go inside and meet the staff. Aquí, a Sparks Pediatric y Adolescent Medicine, hablamos español con fluencia. Español es mi lengua segunda, pero mis ayudantes todos hablan español como su primera lengua. So here's our front door, and we'll go ahead and go inside the office. We'll take a quick look at the waiting room here, and we have it painted a nice bright cheery color. We do have some videos that we sometimes play while you're waiting in the waiting room. These are mostly videos that are either educational or designed. They're actually a lot of scuba diving photos. I'm a scuba instructor. And we want stuff that's not so cutesy that the adolescents and young adults are not happy here in the office. This is our check-in window, and you can see Gina there on the check-in window. She's our usual check-in person. Gina, if you could wave, I know you're on the phone. Okay. And we'll go ahead and take a look at some of the exam rooms. So when you're brought back, you'll be weighed in at one of our weigh stations that looks kind of like this. And then we'll take you into some of our waiting rooms. This waiting room hasn't been cleaned after the last patient, so the table paper's torn. But as you can see, we keep our rooms clean, and they're reasonably spacious. This dark room just brings you back to private offices for Pat and myself, and it's not really a patient care area. This is another one of our rooms that has just had a patient leave. My staff hasn't had a chance to change that one over yet, but actually, we're at lunch, so they'll be changing it over in the next half hour or so. We also just had a patient in here, and you can see some of the decorations on the wall. As we come around, we'll come into the nursing station, and this is Nora, who's one of my medical assistants, been with us almost 11 years, or almost 6 years. And this is Angela over here, and this is our vaccine refrigerator. Well, I guess I shouldn't twist that sideways. We'll just zoom out. So we keep roughly $20,000 of vaccines available at any point in time. There are vaccine shortages all of the time, but as long as we can buy it, it's kept here. We'll take a look at some of the other rooms real quickly, just so you can see most of the rooms here. And you'll notice how we just have these decorated. You'll also notice that we went out of our way here. This room still needs to be decorated. But you'll see we've gone out of our way to make a place that's both comfortable for adolescents and children. Lots of bright colors for the babies, but not a lot of cartoon characters because adolescents don't like Barney. We do have some other exam rooms down that hallway, but they look pretty much like everything else, and right now have a bunch of chairs in there for cleaning, so we're not going to go in there. We regularly clean all of our equipment and regularly clean all of our upholstery and the floors here because we want this place looking nice so that you have a nice, clean, comfortable place for your child when you're both healthy and sick. We don't want a sterile environment, but we also don't want a place that's dirty or frightening. So I hope this tour has been helpful for you to see a little bit about our office and what our staff is all about. And we look forward to seeing you here in the office.